Welcome to the Medicare Minute. Thanks for taking time to tune into the podcast. This is for agent use only. If you are not an agent, please do not proceed.
It's time for the Medicare Minute Podcast, where we talk about anything and everything Medicare related. If it's Medicare, we love it, and we want to help you learn to love it and become successful at selling it so you can help more people. Now, here's your host, Holden and Ron Reed.
Welcome to the Medicare Podcast, also known as the Medicare Minute. This is Medicare 101 with myself. My name's Holden Hassel. And what we're going to go over today is what is Medicare? Just the introduction to it. Who am I? I am a top level producer, been able to produce over $250,000 a year in production, write over 90 Medicare apps in a year, build a multi-million-dollar insurance agency, and continuing to grow like crazy. So this is myself, Holden Hassel, and Mr. Ron Reed. So Ron, go ahead and give it a little introduction of who you are.
Absolutely. So Holden, I'm Ron. Thanks, Holden. Ron Reed, been in the business for quite a while now, 16 years. And over that time frame have personally produced at around 200,000 or more in life insurance. And while also, averaging about 50 to 60 MAPDs annually. And you've got me beat on that one personally. And we've both built rather large agencies as well. Don't know if Holden mentioned that, but I wanted to definitely throw that out there as well. So not only have we built large agencies on the final expense side, but we've also helped multiple agents get into the Medicare space and actually start up and have a successful career and implement and that alongside their final expense business. So today I guess we're going to start out with what is Medicare at its basics, right?
Yeah, absolutely.
So let's start with Medicare. What is Medicare? Well, Medicare is health insurance provided by the federal government. And how do you get it? So how do you get Medicare? Well, you have to work, you have to pay into Social Security in order to be entitled to Part A of Medicare, okay? And then you have Part B and you have to pay for that, okay? Mm-hmm. So let's talk about the differences between that. And before we get into it, I want to cover one of the most confusing topics, I think, for people that aren't familiar with this market and this space is what is Medicare and Medicaid? So those are very different things. So a lot of agents that we've helped through AHIP, I know that's one of the most confusing things they have in the beginning is Medicare and Medicaid and understanding the difference between the two. So I think, Holden, I've heard you mention the difference in Medicare and Medicaid. How do you share that? How do you explain that?
Yeah, that's actually a great question. So basically the way that I'm going to explain it to clients is you have Medicare, which is health care, and then you have Medicaid, which is financial aid for your health care. So it's super important that when I'm talking about these different things, I'll have agents that call me and say, hey, they have Medicaid. Can we help them with something? And the answer is going to be no, there's nothing we can do to help them. But once they enroll in Medicare, we're able to help them put them in a plan, whether it's a Med Sup or a Med Advantage, Medicare Supplement, or Medicare Advantage prescription drug plan. We're able to kind of help them out on that front. So when we're talking about Medicare, and Ron, you can kind of discuss a little bit more about Parts A and Parts B in a second. But so basically what we're looking at is a client that has Part A on their red, white, and blue card, their Medicare card, Part A and Part B of Medicare. And that's how we know that we can help put them in a plan, whether it's a Medicare supplement with a Part D, standalone Part D, which stands for prescription drug plan. That's basically what that is. And you have to have that in combination with your Medicare supplement. Otherwise, you get penalized. Even if you don't have any prescription drugs, you still got to pay a premium with the Part D. And the Med Sup, that does come with a premium. Most of our clients with Medicare Advantage plans, they're going to be paying zero premium. Now, some states may vary, but a majority of the states, it's not going to cost them a premium at all, regardless of what their income is. It's going to be a zero premium plan with no subsidies or anything different. But if someone does have Medicaid, well, that's completely different. I don't want to go too in depth on exactly Medicare and Medicaid and how that works, but just know the basics, right? Medicare, healthcare, Medicaid, financial aid to pay for your healthcare, and that's it. Medicare, you have to work. But Ron, can you kind of tell us a little bit what is Part A and what is Part B?
Yeah, absolutely. So I love the way you describe that. Medicare's healthcare, Medicaid's financial aid. So
Yeah.
Medicaid's provided by the state. Medicare is provided by the federal government, and Medicare is the red, white, and blue card. And now let's talk about Part A and Part B. But I wanted to definitely throw those differences out there. Understand Medicare, federal government, Medicaid, financial aid. Okay,
Yes.
usually provided by the states. So Part A of Medicare, Holden, is the hospital portion of Medicare, right? So most people that have Part A of Medicare do not have to pay a premium for that. You are entitled to Part A for working 40 quarters and paying into Social Security. Okay. So that's how you are entitled to Part A. Now, what happens if you didn't work 40 quarters, or your job, you were paid cash and you didn't pay into Social Security? What happens, right? Can you get Medicare? Yes, you can purchase Part A, right? But it is at a hefty premium. So that's why I say most of the members that we come into contact with are going to be entitled to Part A, and it is provided at no cost to the member. Okay. So now with Part B, all right, Part B is the medical side of things. Okay. And I'm going to break down what hospital and medical is in just a second. But Part B is offered to Medicare beneficiaries that qualify for Part A. And Part B is offered at a premium. So you don't qualify for Part B. Part B, you don't earn it. It is something that is available to purchase. And that is the medical side of healthcare coverage through Medicare. Okay. So Part B currently, that premium is $148.50. So every month, the Medicare beneficiary, when they receive their Social Security check, it's minus the $148.50, right? And that premium continues to go up every year. Okay. And in later podcasts, I know we're going to get into some give back premiums offered by Medicare Advantage plans and things like that, ways to help out with the Part B premium. But at a very high level, that's Medicare. It's provided by the federal government, not state, not financial aid. So Part A is hospital. Part B is medical. Part A, you qualify for based off working 40 quarters and paying into Social Security. Part B, you purchase, it is optional. Okay. Now, with a premium, and that premium goes up every year. So with Part A and Part B, let's break that down, what medical and what hospital does. So hospital is basically for your major health issues, right? So surgeries, inpatient hospital stays, outpatient surgeries, the larger things you're going to run into in your healthcare, that the members are going to run into in their healthcare, that's covered under hospital, right? That's the easiest way I know to explain it, right?
Yeah.
And then Part B, the medical, is more office visits, outpatient services, your specialist, your specialist office visits, your primary care office visits. Those things are covered under medical. So those things that some people could afford to pay 100% out of pocket, those are the things that are covered under the medical Part B. Okay. So Part A, the more expensive services covered under hospital, inpatient hospital stays. Part B, office visits, that's under medical. Okay. Now, to get into Part B and the premium with Part B. So Part B comes with a premium of $148.50. Not all of our members are paying that premium though, right, Holden?
Correct.
So that premium, some of our members are not paying it. How do we know if they're paying it or not? So you get our members, go ahead.
Yeah. That's a great question. So when we're looking at Part A, right, they have to be entitled to Part A and enrolled in Part B to get the product that we're providing, which is that Medicare Advantage plan, right? That's 90% of the topic that we're going to be talking about is Medicare Advantage plans. Now, someone, if their income threshold is beneath a certain amount, what they call the federal poverty level, I don't want to go too complex, But basically, if their income's beneath a certain threshold, they can have what's called the Medicare Savings Program. They can have that paid for. Okay.
Absolutely right.
Great. Yeah. Yeah. So
So
that's one way
I
to
want
get
to
that
touch it. Yep. To touch on that real quick. I'm glad you brought that up. So they have different levels, and I'm not going to get too in depth with it. There's LIS, SLMB, QMB, QMB plus. Those are just a few different levels, right? And there are a lot more. But a lot of members out there, and we're talking about FE and Medicare, right? So we've gone over Medicare, Part A, Part B. How do you get it when you're entitled to it? I'm going to come back to something real quick. But Part B having a premium, with our members being on a fixed income, if you can eliminate part of that premium, it's going to open up an opportunity for more final expense, right?
Yeah.
Because if it frees up money, what do they want to do with that money? Well, they want to leave a legacy, right? So there's some options there. We'll go into that in later podcasts. But if they're paying the $148.50, a lot of people are below that poverty level that you mentioned. And if you just log in, you can help them apply on the spot, right, for that assistance and help eliminate some or possibly all of that $148.50 coming out, and then do other things with it. So back to Part B, though, we're talking about $48.50 that a lot of our beneficiaries are paying. You know whether they're paying it or not by checking their Social Security award letter. That's the letter that they get in the mail, and it tells them what their income is, minus any deductions that are coming out of their Social Security check. Okay. If you can't find that letter, there are other ways to find out. You can always call Social Security, and it's a 1-800 number that you can call, and you can find out more information about their Medicare. Also, you can check their red, white, and blue Medicare card. It will have an effective date for Part A, Hospital Part A, and Hospital Part B will be listed right under that with an effective date there as well. So those are kind of the ways you know whether they have Part A and Part B. The easiest of which, hey, do you have your red, white, and blue card? Just grab that for me, right?
That's
so. Yeah, and then on the Part B premium, there is a penalty that Holden mentioned. If they do not enroll into Part B when they're eligible, there is a penalty that is assessed, and a lot of members don't enroll because they don't want that additional deduction coming out of their check. But what they don't realize is the penalty that they could be facing.
Yeah, that's a great point. And also, like you said, a really cool thing, if someone doesn't have the red, white, and blue card, what can we do to get it? So one, we can always call 1-800-Medicare is the number. It's literally 1-800-Medicare. You can call that number. You can get the information over the phone, their MBI, which is just the number that they have for a Medicare beneficiary. It's their identification number. So you need that Parts A and Parts B, and you can get that over the phone from 1-800-Medicare by providing the information. The clients, obviously, this is going to be done by the client, and it'll help them order a new card, and you can get that information. Another way that you can get the MBI number as well is you can call a carrier, right? Like United Healthcare, they have a producer help desk, which is great. You can call the carrier. You'll need the same thing, like Social Security number, address, date of birth. If you have their current MBI number and you're missing the Part A and Part B effective date, right? So stuff like that. And it's really, really helpful that you can get that information over the phone. And one thing I want to transition into is really important is how many beneficiaries are there right now of Medicare? And there's a major shortage of agents. How do you get started if you wanted to get rolling and get out there and start providing this product to your clients? Well, that's a great question. So right now there's 44 million Medicare beneficiaries, according to AARP, which is a reliable source. So we look on there, 44 million Medicare beneficiaries today in 2021. And by 2030, there is expected to be 79 million Medicare beneficiaries by 2030, and only 9 years away. We're actually coming right on up in 2022 when we're shooting this podcast. So it's pretty short away. Now, with that said, there is only 1.2 million licensed insurance agents in the entire country. Now, does that mean that they're all focusing on Medicare? No.
Nope.
And we know that, right? There's a P&C guy to cover your house, to cover your car. There's people that are focusing more on traditional, more on IUL, more on just annuity. So what I'm thinking, and this is probably true and it's probably less, is maybe 10% of people are focusing on final expense and Medicare. Less percentage of people are focusing on both, right? But focusing on Medicare, let's just say it's 10%. That's 366 clients when we do that math per person right now. So if you're not out there doing it, if you're not getting contracted with the insurance carriers, taking your AHIP exam, which is a certification, you do it every year to get paid, okay, and to maintain your book of business, to get your renewal income, which is what we're focusing on. In 2022, you get paid $287 an application. I know that's not too sexy. It's not a ton of money, but we're not talking about getting rich today off Medicare. This is a long-term play that we want to make sure that you get you. So if you have 287 divided by 12, when those plans renew, okay, the following year, you're getting $24 a month per plan. That's 100 plans. If you write, that's $2,000 a month in that ballpark, right? So it'd be 100 times that total of $287, 28,700. We're going to divide that by 12. We're going to get about $2,400 a month coming in. And I'll say that again, $2,400 a month. Now that's going to pay for your final expense leads, right? That could pay your car note, your house note, whatever you want to allocate it towards. It's going to take a major load off your business, because when we're selling final expense, which we need to sell and never stop, because that's what provides the cash flow, right? Cash flow is king in any business that you're in. You got to keep the cash flow going. But the Medicare is our retirement income, right? That's going to last a long time. How do you get to 6 figures of income before picking up a pen? I'm pretty close to being there. I'm going to tell you that much. I am pretty dang close to being there. Maybe another year or two, and I'm going to be there 100% guaranteed before I do anything. When we hit that next COVID, that next recession, our clients in this business is basically recession proof. There's more money spent on healthcare than anything by the federal government, and it will continue to grow, right? So those numbers are growing to where it's absolutely certain that there's more money being spent on healthcare, cents per dollar, by the federal government than anything else, which is tremendous. So it's just a huge opportunity, and I just don't want you to miss it. And I don't want you to get started, because whatever, and Ron, you tell me this, what everyone says is, I wish I would have started this sooner. Is that right, Ron? What everyone says, right?
I cannot tell you how many times I've heard that, Holden. Yeah, absolutely. Like, I wish I'd started sooner. I wish I'd started sooner. Yeah, absolutely. Yeah. Because the sooner you start, the sooner you're going to get to that 6-figure renewal income. Yeah. There's no doubt about that. And you mentioned, even if you don't even if you just do it for a while, when you get 100, like you said, you get 100 applications, 100 clients on the books, you can do that in 1 year's time. It's not hard. That's 2 applications a week. You're going to run into way more than that, right? And that pays for your leads. It pays your mortgage, whatever you want it to pay, like you said. So why not do it? I've got a message for those that don't do it, right? If you're in there and you're talking final expense, you write them up, ask them about Medicare. If you're not certified, send them to Holden, send them to me. We'll send them to our guys. Yeah, absolutely.
Absolutely.
So,
absolutely.
Yeah.
And one thing that you'll note too, Ron, which is super important, is people are serious about their health insurance, right? They want to make sure that if something happens to them, Medicare is only paying 80%. The plans that we're providing can pay with the Med Sup the remaining 20%. They might have some deductibles depending on the plan. And the Medicare Advantage plan, they're going to have a maximum out-of-pocket expense that they can hit. So they're still capped on the amount of money. So they're not paying that full 20%, which we're going to get into more. But people, just like you and I, we're serious about our health insurance. And you'll find that maybe 8 or 9 out of 10 of our clients that we're sitting down with already have Medicare, right? They may or may not have a plan, which we'll get into. But another question that people will be asking, and we'll answer that next time, is, well, can you sell it all year round? So that's super important, right? We have special election periods. Don't want to get too in depth. We're going to hit that one in the next podcast. But it's super important for us to understand, when we're talking about health insurance, 8 or 9 out of 10 of our existing final expense clients that we're compliantly providing both of these services to, when we're looking at it from that perspective, it's hey, they need help with it, but I'm not asking you to be a full-time Medicare agent. I'm not asking anyone to be that. Out of those 8 out of 10 or 9 out of 10, Ron, we're really only shooting for 2 or 3, right?
Absolutely right. Absolutely right. But since you brought it up, you mentioned Med Sups, right?
Yes.
So I think another thing that we need to cover is Med Sups and Medicare Advantage, or MAPDs, and what the difference in those two are, right? Okay. So, we've gone over Medicare and Medicaid. Medicare is federal government. Medicare is healthcare. Medicaid is financial aid provided by the state. Part A is hospital, Part B is medical, right? So now, like someone says, well, I've got Part A, I've got Part B, I've heard about this Part C and D. I want to make sure they're serious about their health care. I want to make sure I got every part, right?
Yes.
And some people say, well, I've got Part A, I got Part B, I want to get Part C and Part D, and I've got this supplement. I want it all.
They want everything. Let me get the part A, B, C, D, med sup, throw it all in there. And we'll talk about that in our next podcast, which is actually going to be coming up. So we want to do these once a week. Ron and I are going to get on here. And that really is, I mean, that's a brief introduction to what we need to do. We don't want to keep it too long. We don't want to bore y'all with all this stuff. But so let's kind of wrap it up from here. What we're going to be looking at next is how do you even initiate the conversation, completing the scope and doing a presentation, sitting down with your client, reviewing this stuff, really going in depth as to what is a Part C, what is Part D, med sup versus MAPD, special election periods. What are these words you're saying? Follow us for the next podcast. So I'm going to wrap it up. So once again, my name's Holden Hassel. I'm approaching my 8th season up at bat in this business, been doing it for quite a while, performing at a high level, and you only get better by continuing to do what we do, which is seeing people, right? So don't have that paralysis by analysis. There's a barrier to entry by taking a simple test every single year to get stuff done, which there's certain techniques. Reach out to us. So my personal cell phone number is 704-724-3648. And you can reach me also directly by email at holden@finalexpensemastery.com, HOLDEN@finalexpensemastery.com. So Ron, go ahead and give us some closing remarks and your contact information as well. And we'll be on out of here with the Medicare Minute.
Yep. So as the Medicare Minute comes to an end, we're going to talk about in our upcoming episodes, like you said, the differences between med sups and MAPDs, different enrollment periods and all that. But what we really want you to understand is like Holden said, the barrier to entry is like, it's a test. It's not hard. It's not, well, it is hard, but if you study, if there are ways to take that test, and every year it's a couple of hours you spend testing for a lifetime of residual income. Like, it's worth it, right, guys?
Yes.
And what we want to do is we want to make sure that you understand the differences in Medicare and what Medicare is, how it works, how it benefits our members, the different types of plans, and how to market this compliantly, adding it into your final expense business. Okay. So we're excited. We're looking forward to sharing the content, some valuable content with you guys. And you can reach me. I guess that's all I've got, Holden. So you can reach me directly on my cell at 601-490-0520. Call me anytime with any questions you have, and we're happy to help.
What's your email as well? So that way they can
email address. Thanks.
Yeah.
Thanks, Holden. It's rreid. So it's RREID 2179@gmail.com.
Perfect. Great. Thanks so much, Ron. And thanks for tuning in to Medicare Minute. We'll see y'all next week.